Hi, Antara. I'm going to give everyone a few minutes to hop on. Hi, Maria. Give people a few more minutes to hop on. Okay, so I'm going to go ahead and get started. So let me share my screen. Um, and feel free to jump in at any point with questions, comments, or what have you. So first, I thought it might be helpful to kind of go over what we mean by rural. And um, there are different definitions of rural. Different agencies decide on different ones. The Census Bureau defines rural as a town with less than 250,000 people. Now, I think that's an overly restrictive definition because, and don't worry, this will only be till 11 in Tara. Um, but I think that's a kind of overly restrictive definition because a town of under 250,000 people is incredibly small. Whereas USDA, the U.S. Department of Agriculture, which oversees a lot of rural production, defines rural as in a county with without a city of over 50,000 residents, or and that is not a link to a large urban core. So, like a county with a lot of suburbs that's linked, like a county right next to Boston, Massachusetts, for example, would not be rural even if it didn't have a large urban core in it. So according to the census definition, about 96% of Alabama is rural, but only 59%. But 59% of the population lives in urban areas, which means that those that do live in rural areas are incredibly spread out, and as a result, very distant from resources. And rural in a lot of it can actually be defined more as a culture and a frame of mind than just a single definition. And it's everything from a single family living, on isolated from the next town by miles to a small community that is very insular. And a lot of people think of rural populations as a monolith, but there's a rising immigrant population in rural areas. About 1/10 of African American people live in a non-metro area. About 20% of LGBT people live in rural areas. There's a growing Latinx populations and a significant Native American population. And rural areas also have higher rates of disability than the urban areas. And they may have higher rates of religiosity. So some obvious challenges facing rural communities are greater distance from social resources. And this could be anything from being, 10 miles from the high school to 40 miles from a safe center. And which leads to greater poverty and barriers to accessing jobs. There's also very limited access to healthcare. A lot of times you have to drive, 20, 30, 40 minutes just to get to a hospital. And depending on the rural community, sometimes there's limited access to utilities like internet access, or like in the Black Belt, which we'll talk about in a little bit, there is actually sometimes limited access to sewage. So the rural communities face a huge amount of challenges. So even though there's a perception in the US that sexual assault doesn't happen in rural areas, that's definitely not true. It's just very underreported. Only about 50% of serious violent crimes are reported to the police in rural areas. And we'll talk a little bit about why that is in a moment. And this leads to the data being much lower than we know. And there's higher rates of sexual assault from someone that you know, because there are fewer strangers in a rural area. And the more that you know your assailant, the less likely you are to report them. There's also higher rates of incest for that reason, just because the assailant's more likely to be someone in your family because there are fewer people. And reporting rates, because there is such a small sample size, are a lot more sensitive to fluctuation. So what may look like a spike in rates could be a spike in reporting. And some reports show higher rates of assault in rural communities than urban. So we can see that in towns of less than 10,000, sexual assault is actually the highest. And so let's talk about what are some of these barriers to reporting that rural communities face. A lot of it is distance from resources. So a lot of these rural areas do not have their own police departments. They have county sheriffs that, may have to travel 20 minutes just to take a report. You may be 40 miles from the safe center. You may not know about the safe center because it's just not heard of in your community. You may be very far from a hospital. And a lot of rural communities have limited transportation. There's almost no public transit. And if you're dependent on somebody else for a car, it may be difficult or impossible to be able to report in private. Some communities have poor quality roads, so it may not be safe to be driving at night to go to a police station. And there's still limited cell phone service in a lot of rural America. So, you may not have the ability to call the police if you don't have a landline. Uh, and because of that higher degree of interconnectedness, um, if the assailant is a member of your family, there may be possible economic dependence. And due to higher rates of poverty, that can definitely influence your willingness to report. Because there are fewer social services, rural communities have a less degree of familiarity with them. And they also have a greater distrust of social services, and they don't know how to access them in the first place. Many insular immigrant communities, which we'll talk about in a later training, face language barriers and can't really communicate with law enforcement, especially because law enforcement may not have anyone on staff that speaks their language. And also in the US, most sheriff departments are through the county, and county sheriffs are elected. And so they are very attuned to the power of public opinion because they don't want to lose the next election. So a survivor, especially one that isn't as well known in the community as the assailant, or has less social power than the assailant, or in a community that's very conservative, which rural communities in the US are more conservative, they may be worried that the police won't believe them or won't want to prosecute the case because the police don't want to lose the next election. And there's a lack of police training, and especially if the assailant lives in one county, the assault happened in another, the survivor lives in a third, the police can get very territorial about who deals with what. So Maria asked if there's any pros to living in a rural area, and we're going to go over that in a minute. There definitely are some pros to living in a rural area, both in terms of access to and both in terms of sexual assault services, but also just in general. So, but first we're going to talk about some cultural barriers to reporting. So, like I said, there's a higher chance of knowing the assailant personally, and this is the #1 barrier to reporting because of all the reasons. If the assailant is a member of your family, you don't want to rip apart your family. If he is your child's father, you don't want to report, deprive your children of his income. If she's, a teacher at your school, you may not be worried. You may be worried about not being believed. And there's also a lack of anonymity in reporting. And I cannot overstate this. In a lot of these rural towns, just driving to the police station and having your car parked down in front. If everybody knows what your car looks like, people may ask you why you are at the police station. So something that simple that wouldn't be a barrier to any of us is a huge barrier to someone living in a rural community, which is one of the pros of the Safe Center being outside these rural communities. With Fran, our staff therapist, living in Birmingham and working in Tuscaloosa, it is guaranteed that she will not run into somebody from Fayette at the grocery store. And that's something that we can reassure them of. And a lot of people that live in rural communities purposely chose to live in rural communities because they are more solitary in nature. And there is absolutely nothing wrong with that. But someone that's more solitary in nature might be less likely to trust the police or social resources. And they may be more reticent about using these forms of assistance. Especially there is a lot of, especially here in the South, there are high degrees of pride around using social resources, and that that you don't want to rely on handouts from a stranger. Um, there's also, especially in the southern U.S., huge social mores about protecting family reputation. So if an assailant is a member of the family, or if the family believes that sexual assault is something to be ashamed of and keep hidden, and like I said, you know, reporting in a rural town means everyone will know. There can be huge barriers to that. And also, if the assault is happening within a family, there's less, or within a church community or another a small community, you have less exposure to beliefs that will challenge those beliefs. And so someone might just think this is the norm, that this is what happens to people in their community. Um, and conversely, because in the US, we tend to believe that sexual assault is something that happens between strangers. Um, People think it doesn't happen in rural communities because there aren't strangers. So to believe that sexual assault happens in rural communities means that you're distrusting your neighbors, your friends. There's also higher degrees of retaliation because everyone knows where you live. Everybody knows where you work, where you go to school. Um, and yeah, Maria asked if there's a greater shame of offending too in a rural area, and we're definitely going to touch upon that. Um, but the last barrier to reporting is that your reputation influences your likelihood of being believed. And so if somebody has a reputation as being less reliable, the entire town knows that. But let's talk about some of these assets. So the police are really well known in a rural community, and they have a function, a social function as well. They're, because it's a smaller area that they're policing, they, you know, will help out at community events and things like that. So someone may be more likely to trust the police, and they may know them in a non-threatening context. Because the community is smaller, and everyone knows everyone, and a lot of times people move to rural areas specifically because they believe they're safer. There's a huge community investment in keeping the community safe. And so that means that when people do find out sexual assault is happening in their communities, they may be more likely to act on it and want to keep their community safe because it will affect your family. It is easier to spread the word about services because everybody knows everyone. And so once a service does come to be trusted in a rural community, it will be likely to be relied upon. Which is also why it's really important that our rural survivors have a good experience, because one negative experience can turn off an entire town. Also, higher degrees of religiosity may provide a source of social comfort to some survivors. And like Maria said, there are in a rural community that sees sexual assault as a problem, there would be a higher degree of shame of being an offender. And an offender, would be well known, and it could very much impact the reputation, which it can go both ways. Of some survivors may be afraid of, this wasn't serious enough, I don't want to destroy their reputation. So that can be both an asset and a harm. Does anyone have any questions on anything in this section before we move on? Okay, so let's talk a little bit about our service area. As y'all may know, we have 9 counties that we work with in West Alabama. So it starts up here with Fayette, and goes to Pickens, Tuscaloosa, Bibb, Hale, Greene, Sumter, Marengo. I think that, let's see, 1, 2, 3, 4, 5, 6, 7, 8. It's one I'm forgetting. Where is, and Lamar up here. So this area where my mouse is where we serve. And the only town that the only county that would not be rural in here is Tuscaloosa. We'll still talk about that a little bit, but most of these areas are highly, highly rural, and even Tuscaloosa has rural components. So we're going to go over a little bit about these rural counties, and a lot of this is in these counties are what's called the Black Belt, which is this swath of the state roughly about here. And definitions of the Black Belt, just like definitions of what is rural, change. So at the Black Belt is about 17 to 21 counties, including the following counties in our service area. Some definitions include Bibb. Greene is always included. Hale is always included, so is Marengo. Pickens is included in some definitions, and Sumter is always included. And the Black Belt is named for the dark, rich soil in those areas. And it's part of a larger Black Belt of the southeastern United States. And it also has a larger African American population. And it was a huge site of civil rights activism. And the Black Panther Party was actually founded in Lords County, which is in the Black Belt. This part of the state still suffers from huge degrees of poverty, poor social services, poor health outcomes, and limited access to healthcare. And it's still very impacted by the legacy of slavery. And includes 9 of the 10 poorest counties in Alabama, and some of the poorest counties in the nation, including Greene, Hale, and Sumter County, which are in our service areas. They have a rich blues and bluegrass music tradition. And like I was saying earlier, there are a huge lack of resources, including a lack of adequate sewer resources. So there is raw sewage that the residents were actually fined for, rather than the county being providing. Up until 2014, residents could be fined for not having access to sewage they would have to pay for out of pocket. And the UN, as recently as 2018, has investigated this, showing that this is a huge health risk. And there are huge rates of people struggling with ringworm, which are conditions that we tend to think of in the United States, occurring more in developing nations, which shows a lot of our hypocrisy around how we treat rural areas in the United States. That these are having adequate sewage and being free from ringworm are methods by which the United States declares other countries developing or not developing nations. So I'm going to go over the counties one by one. I don't expect you to remember these stats by any means. I just think it's important to have a rough familiarity with the counties we're serving. And feel free to jump in here with any questions in the chat or just turn off your mic. This is very informal. So Bibb County is one of the larger ones in that it has 22,000 people, and it's predominantly white. The county seat is Centerville. The largest town is Brent. I think it's just helpful to know these towns. So if someone mentions, they live in Vance, okay, that's in Bibb County. It's a slightly larger town. Now, Bibb County is a dry county. So what that means is it is illegal to sell alcohol in that county. There are some wet cities, including Centerville, and that means it's illegal to sell alcohol in that city. So why this is important is if a survivor is drinking, even though that is legal, they may be worried about getting in trouble, or there's a huge social stigma around drinking. A survivor may be at an illegal bar. They may be drinking alcohol that is homebrewed, called moonshine, that they don't know what's in it, and it may be very, very potent. And so a survivor who's been drinking or has been in these situations may be worried about reporting to the police. This is one of the Black Belt counties, depending on the definition. There was a very controversial podcast called S-Town about a gay man struggling with mental health conditions who spoke very disparagingly of living in Woodstock. That brought a lot of notoriety to this community and a lot of outsiders, much to the chagrin of the people who lived in the community. There are some great natural resources like the Talladega National Forest and the Cahaba River. There's a strong healthcare resources, and there's a strong mining and timber industry. Fayette is a little bit smaller. It's also predominantly white. And Fayette is also the county seat, largest, and there's only a few population centers: Berry, Glen Allen, and Belk. It's also dry. Some resources include the Fayette Art Museum and the Sipsey River, and it has a lot of agriculture and manufacturing. Greene is predominantly African American, and the largest city is Utah, and it's or Etowah. I think that's I'm not sure I pronounced that. And Forkland, Boligi, and Union are some other population centers. This is on Choctaw ancestral land, and there's still a sizable Native American contingent, as you can see. It's the home of the Black Belt Roots Festival. There's fishing, hiking, camping. There's also high poverty rates in Greene. Hale is also a Black Belt county that's predominantly African American. And the largest city is Greensville. Moundsville is also a predominant city. Moundsville is named after the Mississippian era, named for the Mississippi Indians, an archaeological site that has these beautiful archaeological mounds built over 1,000 years ago by the Mississippian era Native Americans. And it's still an active dig site. It had and it's Choctaw land, and it's a very historical civil rights site, including the Safe House Black History Museum that looks at an actual safe house on the Underground Railroad where MLK stayed when invading the KKK. And it's home to Rural Studio, which is a project by Auburn to build adequate housing in rural communities. And these are some really cool, innovative architecture, which has also brought some outside attention to Hale, which a lot of the residents do not like. It's largely rural and agricultural. There's high rates of poverty still. And there's a lot of interesting health innovations like Horseshoe Farms that pairs medical students preparing for medical school with high needs health patients to give them access to services. Lamar is a predominantly white county. The county seat's Vernon, and you can see the largest city, Sulligent, doesn't even meet the definition of being remotely urban. It's very rural, only having one county seat and one other population center of Millport. There is a Backstreet Opera in Vernon, and it is a dry county, like we were saying. Marengo is predominantly African American. It's a Black Belt county. The county seat is Demopolis. The county seat is London, and the largest city is Demopolis, which, as you can see, is about 3 times the size of that in Hale or Lamar. And it does have a few population centers. It's on Choctaw land, and it does have the Tombigbee River and the Black Warrior River for recreation, fishing, hunting. Pickens is a predominantly white county. And the largest city, Aliceville, has a lake that has a lot of fishing and hunting. It has several counties, population centers. It is in the Black Belt, depending on the definition. It is a dry county. There are high rates of poverty. It was home to a German prisoner of war camp that's now a museum and cultural center. And they have several prominent festivals, like the Willie King Freedom Creek Festival, that's a music festival, Dogwood Festival, and Mule Day and Chicken Fest. So, knowing these festivals and cultural events, again, you don't have to memorize these, but being roughly familiar, cultural events, there's higher rates of people being together, celebrating, drinking, and there's higher rates of sexual assault. So, these are days that you might, if someone mentions like, oh, I was at the Dogwood Festival, knowing like, okay, that is small cultural festival with like rodeos and things like that, and having a rough familiarity with it can help your survivor feel more comfortable.
Theo, do they allow, I'm sorry.
No, go ahead.
Do they allow drinking in the festivals?
I am not sure. A lot of these dry counties do have, I think Carrollton, which may be the site of some of these festivals, is a wet city. So they would allow drinking there. And again, in the dry counties, it's not illegal to drink, it's just illegal to sell alcohol. And a lot of these counties do have what's called Sunday laws or blue book laws, where you can't, they don't sell alcohol on a Sunday, even if it is a dry, even if it is a wet city. That's a great question, right? And Sumter is our last rural county. It is predominantly African American. And the largest city in the county seat is Livingston. You can see it has a few county centers. It is also Choctaw ancestral land, as is much of this area for the Black Belt. It has hunting, fishing, boating, both private and public. It's home to the University of West Alabama, so it has the only university, to my knowledge, outside of Tuscaloosa and our service areas. Has a Coleman Center of Arts, and it also struggles with high poverty rates, as does much of the Black Belt. And the last county in our service area is Tuscaloosa, which I didn't go over as much because you have more familiarity with the city. It is predominantly white. As you can see, Tuscaloosa is larger than the rest of our service area combined. It's home to 3 universities, including a historically Black college, and has Black Warrior River. There's a site for a lot of hunting and fishing. So before we go on to a case study and really discuss like how you would approach this case, what are some challenges in these areas, I wanted to give you guys a chance to discuss anything on your minds.
I'm wondering about those dry counties. I wasn't clear as to whether you would predict or expect more violence and sexual assault in a dry county or less.
That's a really good question. And I think, to be honest, in my opinion, making a county dry doesn't prevent people from drinking. It just drives things underground. So people a lot of times will drive over the county line just to get alcohol, or they will homebrew alcohol, which I said can be a lot more dangerous and potent, especially if someone doesn't know what they're doing really. And that can, lead to situations just like somebody who's involved in illicit drug use wouldn't feel comfortable going to the police. Somebody that, was assaulted by their, moonshine dealer might not feel comfortable going to the police.
Right.
And it can create these underground situations. But I think the idea in a dry county is that it would create less violence. So people may not see it as happening in their community. And there may be a higher stigma around any sexual assault that is due to alcohol use. And that's a great point, Antara, that things are very similar in rural Bangladesh. And I think that think like the United States likes to act like we are a very, very well-developed nation, but the majority of our land, not our population, but our land is rural. And we largely neglect rural populations in this country, especially rural populations in the deep South. And it does not shock me that it's very similar to rural Bangladesh. I think, except we look down on other rural countries, where in which we have no right to do, and nor should we even if we were developed, because that's just hateful. But people don't realize the lack of services. And even I didn't realize, I grew up in a metropolitan area, and I've lived in either suburban or large metro areas my whole life. So it wasn't till I was doing outreach to rural libraries and I realized for most of these rural counties, which the county may be 96 miles in diameter, there's one library for the county. You may have to drive 30-40 minutes just to get to that one library that closes at 5 p.m. and is only open 3 days a week. So that is something that was baffling to me. That a lot of these rural counties don't have, the city government doesn't have a website. They have a Facebook page for the whole county. Which when you think about that there is a county Facebook page that you're following. So everybody in the county, so you have to have a Facebook. So if you don't really know how to access these resources. And if you do, people from the county will be able to follow you on Facebook or find you. So like just that level of lack of privacy is something that I've never thought about in my life.
Maybe it's because to have a website, you would need to have a web person, webmaster, they call them, who,
Exactly.
yeah,
Yeah,
and
you
that's
have to have a web,
costly,
and it costs money.
right? To
And
maintain
these
it and all
rural
that,
counties are running on shoestring budgets.
right? And Facebook is free.
Yeah, exactly. So there's no shame in that. It's just there's a lot of barriers there to just but it's just but there's also a lot of at the same time there's a lot of familiarity with that, and everybody knowing these social services and seeing each other, like I saw on a lot of these rural libraries Facebooks, they would celebrate the mail person retiring. That's something that you would not see in an urban county. And it's a lot of community. Like, I think some of the benefits that we haven't talked to about why we talked about benefits of reporting, but benefits of why someone would live in a rural county is a perceived safety. Everybody knowing everybody can be a good thing too. People like that idea of the village raising the child, a feeling like it's safe to let your kids, you know, ride around on their bikes after dark because you know who the mail person is. You know who the grocery store clerk is. You know who everybody is. And that you don't have to wait in lines at places. It's not crowded. It's not overwhelming. And that your whole family has lived there for generations in many cases. And those are some of the benefits of living in a rural area. Of it's quieter. And
A lot more green spaces, I would say.
Exactly. There's a lot of nature. A lot of, like you saw, a lot of people's recreational activities are hunting, fishing, hiking, kayaking, canoeing. And you're away from the smog and the pollution of these urban centers. It also means that people are doing a lot of physical labor. There still are retail jobs, don't get me wrong, and agriculture is not the predominant industry, but it's still a large agriculture, timber, mining are a large resource in these areas. So people are doing a lot of physical labor and are outside a lot. And a lot of people like that lifestyle. And it's a great lifestyle for a lot of people. Any other thoughts on rural areas?
I wonder, since people are outdoors so much and doing so much physical labor or physical work, they're probably stronger, you would
Ye-
think, right? You know, more
Yes
muscle
and no.
build.
So I think they would be physically stronger, but also it can be very backbreaking a labor that ages you
That's
prematurely.
true. That's true.
Yeah,
Um,
especially in those mines. And
mhm,
that is a catch 22 for a lot of rural areas. Those mines are incredibly detrimental to people's health, but there
mhm,
may not be another job, especially because the mining jobs are relatively high paying and you can get a job right out of high school. So when
mhm,
we're talking about things like climate change, that disproportionately affects rural impoverished communities, people may be reticent to give up reliance on fossil fuels because their family's livelihood depends on them.
mhm. And sometimes it's generational type of labor too, where
Yeah,
your,
definitely.
your parents did, your father and your grandfather and so forth. So it's part of the tradition, I guess, of that family.
Yeah.
And
And
they
the
take
and the
pride in that.
agriculture definitely is what used to make these areas very wealthy. But
Mhm,
there's also a lot of sharecropping
mhm,
that relied on poor, Latino communities and poor Black communities being almost re-enslaved to the land.
mhm,
That was eventually done away with by mechanization and just led those communities to be very impoverished. So we're running up on our time. So I want to
okay.
jump to the case study, which I'm just going to read because it's a lot of text. The morning after a party hosted by in her home by her abusive husband, Jane was given the task of driving a male guest home. After dropping one of them off, she was left in the car with her husband's cousins, who offered to show her a shortcut to his house. Tired and wanting to get rid of him as quickly as possible, Jane agreed. The shortcut did not go to his house, but rather to a strip mining site far from anything else. The man forced Jane into the backseat of the car where he assaulted her. Afterwards, he threw her out of the car and physically assaulted her. And she ran in the middle of nowhere. She ran to the sound of equipment running and came upon a man driving heavy equipment a mile away from her assault. The man called 911, but the police got lost in responding to the call on the way. Jane now faces the ensuing police investigation and prosecution with little or no support from family and friends. She experiences a legal system that may blame her. She lives in a community that does not believe it happens here. And if it does, she must have asked for it. And she is also facing memories of childhood sexual abuse stirred up by the recent assault. And this is from a study on rural sexual assault called Unspoken Crimes by the National Sexual Violence Resource Center, which is a great educational resource. So, what are some thoughts that people have about this case study? Some of the barriers that Jane has, and how we could make her feel comfortable as an advocate?
I think when she arrives at Safe Center, we first tell him that we believe in her and that it happens to it can happen to anyone. It is not her fault.
Yeah,
But I'm not sure how the police thinks or how she can approach the social safe center if the person she has turned into the heavy equipment supplier. Yes, if he doesn't know about the social safe center.
that's a great question, Antara. So we do outreach about the with rural. We're not as in tune with rural police as we are at Tuscaloosa Police, but we have done trainings with rural police departments. So the police should take her to the safe center. Um, but that is an extra step. And she may if we may be 40 miles away. So it will maybe, and she might get to a rural hospital first. She may go,
If she can
the police
find
might,
one.
yeah, she may already have driven 40 miles to a hospital, then be told after waiting in the ER for an hour, If they triage her appropriately, it might be 3 hours that she then has to come here. And for a lot of people, that is too many steps. For the majority of people, that is too many steps, and they get lost in the shuffle. So we're trying to do more outreach with these rural police departments and do postering in libraries, at rural health fairs, at stuff like that, to answer your question about how they know about us, Antara. And I really, the number one thing, you're right, is that anything that helps an urban survivor will help a rural survivor. Saying that you believe them is the most important thing we can do. And that it happens anywhere. And, making sure that she's safe from her abusive husband, which may be the bigger priority. Especially in the rural South, and the urban South too, especially in the rural South, even for non-abusive relationships, there's very much a honor mentality. And this is insulting the family's honor, because when people don't have much in terms of material possessions, they cling to what they do have, their dignity, as well they should. But a lot of survivors I've encountered from rural communities are very afraid to tell their husbands, because they're afraid their husbands will retaliate against the abuser and land themselves in jail, because they don't, their husbands may see this as a violation of the honor, or like here, the husband could side with the cousin, or the husband may feel so violated by his cousin that he would attack the cousin, or Jay may be afraid of tearing the whole family apart. So I think here, just reminding her she doesn't have to report today is another big thing. And just being aware of these things and being able to validate it is huge.
And Theo, would we offer her counseling, an opportunity to meet with Fran? And would that be like telemedicine since she lives so far?
So we do telemedicine. Right now, unfortunately, somebody has to have internet access and a computer to do it. We are getting a grant. Well, we're writing a grant. Hopefully we'll get it, knock on wood, fingers crossed, to be able to give iPads to people in these rural settings. And even internet hotspots to be able to access Fran's telemedicine. But we do telemedicine with Fran. That was one of the few good things to come out of the pandemic.
And I'm wondering too, if they're not able to connect through the internet, could it be a phone call, or is that not something that?
I think right now Fran doesn't do phone medicine, but I know that is something that, I'm not sure if she's exploring. I know phone counseling is just so tricky because you can't read someone's body language or see their face, see how they are.
Right.
But like there are crisis lines that we can refer them to, and that is a rough start. It is not a substitute for counseling by any means, but that is something that we would want to have those resources on hand, and I'm putting together.
Is there any coordination between the police here in Tuscaloosa and the police in a rural area to facilitate the police report? Or is that completely
I'm
separate?
not sure. That's a good question. A lot of these rural areas, like I said, are very territorial about their police because they don't want somebody else coming in and taking over their investigation and telling them what to do. And there's hierarchies, which make it really challenging. Also, even getting the rural police to come and pick up a kit is challenging. When we had a survivor who was assaulted in like South Alabama, it took us 6 months to get the police to come pick up the kit, pounding them.
My goodness.
And I think we eventually like drove it there halfway.
Yeah.
But a lot of times they don't even know the chain of custody of these kits. It is very, very challenging. Which is where we're trying to do some of that outreach.
Theo, are you planning on sending advocates out to rural areas, or do survivors always come to the Safe Center?
Unfortunately, right now, we always have to come to the Safe Center unless it's a hospital case. Like if somebody is not medically stable, we would go to the rural hospital. The dream is to one day have a mobile unit.
Yes, that would be a dream.
Yeah, Birmingham Crisis Center does have a mobile unit for their rural communities. So unfortunately, this is where I have to wrap things up.
Okay.
But you all have had great contributions and great questions. And I just want to leave some time for any last questions.
So does the Birmingham Center and the Tuscaloosa Safe Center, they work in collaboration or they're separate?
So we all work under the Alabama Coalition Against Rape, ACAR. And we all have our own service areas. So except for 3 counties where there's nothing, every county has a center that does assault in the county. Some aren't as specialized as ours. Some are like hospital centers, but we do collaborate with those centers. You know, like if somebody was assaulted in Blount County, which is a rural county in the Birmingham area, but they were a Tuscaloosa County resident, we would work together to get them services. And we have like monthly calls where I meet with the advocate coordinators in those counties, and we all kind of learn from each other.
Okay, thank you.
You're welcome. That
For the
was a great
training.
question. Well, thank you very much. And this was really engaging. And next month, as you two know, because we've emailed about it, we're going to talk about immigrant services and English as a second language learners. And then in September, because the United States, it's Hispanic Heritage Month from 16 de Septiembre, which is the Mexico's Independence Day, till I think about the same day in October, we will be doing a presentation on Latino survivors. As you could tell, there are a lot smaller pockets in these communities, which can lead to a lot of isolation and insularity, which is something we'll talk a lot more about.
Theo, thank you for this interesting presentation and very informative presentation too.
You're welcome. Thank you for coming and have a great rest of your Saturday.
You too. Bye, Antara.
Bye, Antara.
Bye, everyone.
Maria.
Bye.
Bye-bye.